My name is Tom Tamura. I am an otolaryngologist, head and neck surgeon, or ENT. Originally, I'm from the East Coast. I've lived as far south as Georgia, as far north as Vermont. We've lived in South Dakota for about 6 years here. We moved with my wife and 3 kids, and we've loved it here ever since. So sinuses are air-filled cavities that generally make up a fair portion of your face, meaning you have sinuses in your forehead, your cheeks, between your eyes, and there's one set of sinuses that's further back in your nose. Generally, the most common reason that I see patients for sinus disease is for either chronic infections or recurrent infections. Sinuses are air-filled cavities that drain into your nose. So generally, the drainage sites for these areas are relatively narrow. So if you can imagine, anything that causes more inflammation in the nasal cavity is prone to blocking those off. Now, sinus disease is obviously an infectious disease, but the more we see patients and the more we learn about patients that have chronic troubles with their sinuses or have recurrent troubles with their sinuses, we find that a large underlying portion of their problems is that they have chronic inflammation in their nose, whether it's from allergies or other problems. The general guidelines are for patients that either have chronic sinusitis, which means that they've had 3 months of disease and they've failed appropriate medical management, which would generally be antibiotics for a several-week course in conjunction with steroids. Many times we'd hope that we could get a nasal culture, so those antibiotics that we use to treat patients with, that we know that have been sent to the lab, and we know that the antibiotics should work but are still not clearing things up. And after having had that amount of treatment, having a CT scan that does still show some sinus disease, those patients would be candidates for sinus surgery that have chronic sinusitis. Now, there's another subset that have recurrent sinus disease, and those patients have about 4 sinus infections a year that is confirmed with a CT scan. Sinus surgery classically is performed under general anesthesia in the operating room, and this is all performed with small scopes, meaning there's generally no incisions on the outside of the nose. It's all performed endoscopically. And remember, the air-filled cavities, the goal is to make those drainage openings larger so that any kind of swelling in the nose is less likely to plug those up. Now, the true results, I'd love to say that the true results are that sinus surgery will cure patients of their sinus disease, but the realistic expectations are generally that they'll be less frequent and less severe infections. There tends to be some variability in how patients recover. The classic course is that patients are congested, because many times it does involve placing some nasal packing, and there's an amount of pain that is controlled by the prescription pain medications. Patients that have sinus surgery that tend to be prone to headaches or migraines, sometimes they have a more difficult course, because on top of the pain from the surgery, the inflammation in the nose can set off some headaches. In general, the maintenance therapy, it depends somewhat on if they have nasal polyps or the extent of their sinus disease, but the goals in general are decreasing inflammation on the nose. And really one of the most simple ways to do that is using nasal rinses or neti pot rinses, and that has some good success in decreasing the inflammation in the nose, along with combinations of topical sprays sometimes, and obviously treating if there are still occasional sinus infections. So I think this is an exciting time for nasal and sinus care here in Brookings. Brookings Health has invested in top-of-the-line equipment for the operating room, and I think this really will be an asset for the population here.